fertilization is no joke. It's not that easy, to go through all the biochemical processes for the sperm to get actually up to the egg and fertilize the egg, and for the egg then to get where it needs to be within the certain time limit. Just messing it up a little bit really disrupts the whole process. Again, we're really trying to turn the paradigm on its head, that instead of having to do something every single day to stay non-pregnant, let's just do one thing, make non-pregnant the default state, and then when you want to get pregnant, great, come on in, start your prenatals, we'll take out your IUD or your implant, and you're all set to get pregnant. The fertility rate returns the next month with both the implant and both the IUDs. So why not make it something that's really easy to do? Young people have such complex lives. Sometimes I'm at my mom's, sometimes I'm at my dad's, sometimes I'm at my apartment, sometimes I'm at my boyfriend's apartment. I have 2 part-time jobs and I go to school. Try to take a pill at the same time every day, forget about it. And that's why we see that the failure rate of pills, patch, and ring are actually twice as high for women under 21 as women over 21. It's not that the pharmacology is different and somehow the medicine doesn't work in young people. It's that it's complex to use.
The IUD helps them not get pregnant.
Exactly.
If you're young, especially.
Absolutely. And so, this program where we've been able to give out over 30,000 free IUDs and implants in Colorado, dropping the pregnancy rate, like we're talking about, it really gives women the opportunity to have the family they want when they want it. It's good for women, it's good for families. So the way IUDs work is they actually stop sperm. So the copper IUD basically releases copper ions continually into the fluid inside the uterus, and so when sperm swim up in there, they're basically pelted with copper ions, which destroy their cell membrane and don't let them get up into the fallopian tubes, which is where they're heading to meet the egg. The way the progestin IUD works, it actually causes the cervix to make a thick plug of mucus that the sperm can't get through. And so, both of them act to prevent fertilization. Every so often, a patient will be concerned and say to me, well, I just was wondering, the IUD sounds great for me, but does it cause abortion? And I explain to them how it works, and we have a discussion around that. So I would say one thing that the political debate has done is maybe confuse women a little bit, and I'm glad that my patients at least have the opportunity to talk to me about it. Obviously, some people still don't have a healthcare provider they can get to answer these questions.